Welcome to Lake Iseo in northern Italy. My name is Alexander Reed. We're about 10 minutes away from the European Parkinson Therapy Centre, a charity that I founded and direct and which now operates in over 40 countries. It's beautiful, isn't it? I've come down to the lake to add a bit of colour to what on the surface is a fairly depressing outlook for people with Parkinson's and indeed for national governments. Soaring costs, soaring numbers, families torn apart and devastated by Parkinson's, and health budgets crippled by the weight of it all. Some countries are already moving towards the model I will outline today. Others have yet to understand the enormity of the picture and that change is imperative. Indeed, in many countries, the way in which Parkinson's is treated is outdated, ineffective, and far too costly. As at the European Parliament recently, I was together with the European Parkinson's Disease Association, and I got the strong impression that many members of the European Parliament have not got a clue about what is going to hit them. How change can improve the lives of people with Parkinson's and also reduce the costs involved in looking after people with Parkinson's. To do this, we need to go back to the centre. So we'll come back here later. But for now, come with me. Okay, we're back here in the centre, in a change of clothes. Mental health accounts already for about 45% of health costs across Europe. The total cost in Europe in 2010 of brain disorders was 798 billion euros, of which direct health costs were 37%, direct non-medical costs 23%, indirect costs 40%. Average cost per inhabitant was a staggering 5,550 euros. In 2010, that's a little time ago, the total European cost of Parkinson's disease was 13.9 billion euros, with predictions of it going up over 30 billion by 2040. Parkinson's is a pandemic of epic proportions. Pandemics are usually infectious, but when such names as Ray-Dorsley, Bass-Bloom and many others point to the fact that even though Parkinson's is not infectious or viral, it does not change the fact that it is a pandemic in almost every other sense of the word. Interestingly, the two names mentioned previously conclude the PD pandemic is preventable, not inevitable. Look up Webster's definition of a pandemic: an event occurring over a wide geographic area and affecting an exceptionally high proportion of the population. We are not talking about some old man's disease. Set against this backdrop of lack of funding, the fact that many people with Parkinson's do not get even the simplest of information, and there's an over-reliance on hospitals instead of care in the community. And this has resulted in the fact that too many people with Parkinson's are afraid to get advice, don't know how to get advice, and live without advice. The pandemic is fueled by an aging population, people living longer, also raising their chances of getting Parkinson's. Less people are smoking. Nicotine may ironically be a neuroprotector. And of course increased pollution and increased pollution of our food chain. In the past century, society has successfully confronted pandemics of polio, breast cancer and HIV to varying degrees. Central to the success of these efforts was unbridled activism, as stated by Dr. Dorsley. I don't see much unbridled activism in Parkinson's at the moment. Ironically, these costs are considered on the low side. Often carers have to give up their jobs and hence stop paying tax revenue to the government. I have Parkinson's for over 11 years, and I know that building more hospitals is not the answer. I do not need a degree in neurology to know this. I have Parkinson's, and believe me, I know Parkinson's. And the last place I want to be is in a hospital. Bas Bloom has been one of the main innovators and is a charismatic leader in the Parkinson revolution. He describes Parkinson as a complex individual condition. He is, of course, the co-founder of the ParkNet system and promotes the need to make neurological physiotherapists more accessible and closer to people's homes, and the need for education and a partnership between people with Parkinson's. Here in the Italian Centre, we use an innovative approach called the 4 pillars. A technique that has been particularly taken up in ambitious Parkinson projects like the Parkinson UK programme called First Steps. Education is at the heart of this programme. It's also designed to empower people with Parkinson's to have a better quality of life. The full programme of 4 pillars covers medicines, neurological physiotherapy, lifestyle and psychology. Acceptance and the way in which we see our Parkinson's has a huge impact on the way we live with our Parkinson's, being at the core of the psychological aspect. All of this is backed by our ability to understand the real needs of people with Parkinson's. This centre is a joint collaboration between experts and people with Parkinson's, and understanding Parkinson's from a medical and from a human point of view is at the core of all of what we do. The managing director of Parkinson's UK, Steve Ford, has stated publicly that Parkinson's UK has a goal to reach all people newly diagnosed at the the point of diagnosis. We showed Parkinson's UK the First Steps programme 6 years ago, and after a trial near Oxford, it was gained approval for a national rollout to 21 centres across the country. Patient-centred early intervention is defined as giving people with Parkinson's and their families, as shown, as soon after diagnosis as possible, facts about Parkinson's, how to limit symptoms, slow progression, and help them ease into their new lifestyle, motivated and self-empowered. This is usually done over a 2-day period with about a 4 months separation between the 2 days, involving family in a non-hospital environment, presented by especially trained people with Parkinson's, but designed by experts and given in groups of 6 to 7 people, always held in a wellness environment. In the pilot study we used a golf club. Early intervention is also very important for psychological matters. The psychology of being diagnosed with Parkinson's is often understated. What often happens is we start getting anxious and fearing for the future. That fear is a normal human reaction, and we also start to get possibly depressed because we start seeing things we used to be able to do that we can't do anymore, and we start feeling less complete. Depression comes from the past, and you mix those 3 words together, you can often get the worst situation possible. One famous neurologist said, "I can treat Parkinson's, I cannot treat apathy." Well, there's research done on this recently. It's a major piece of research, and it asks a question: what is it that destroys the quality of life of a person with Parkinson's? It's called the Parkinson Outcomes Project. I want to just read you the interim findings of that report. It stated, the quality of life of a person with Parkinson's is directly related to his or her mood. In other words, it's not Parkinson's that will destroy our quality of life, but rather our emotions. Apathy, fear, depression, and anxiety. It goes on to say, our goal as physicians is not just to help you function better, but help you feel better. There's a difference between function and feeling, and we've found that how people with Parkinson's feel, their mood and depression, is a critical factor with a tangible impact on overall health. And the symptoms patients report as having the most effect on their health status are negative mood and depression. Well, I have a question for you. Who actually is out there to help people who are newly diagnosed with Parkinson's face the reality of Parkinson's, show them that they can live with Parkinson's, and show them that Parkinson's is not the end? There's nobody. The associations do what they can, but the associations mainly get the people who are already decided they want to fight. The truth of the matter is many people with Parkinson's fall by the wayside and don't get help. And the result you've seen for yourself. feeling strange the last few weeks. Slowed down. Tired. I can hardly sleep at night.
Parkinson.
Any marketing consultant would state that you must always start building anything new and successful based on unsatisfied customer needs. The EPDA, European Parkinson Disease Association, together with the London School of Economics, carried out a pan-European survey, and in summary, there were 3 elements which were identified as important to people with Parkinson's and were not being sufficiently addressed. These were, as you can see on the screen, early intervention, care in the community, education and support. Oh, and I did forget, they did mention find a cure. Simple, small, multidisciplinary centres, like this one, can have a huge impact on people's lives. People living locally get specialised treatment covering over 12 different disciplines, from NSVT voice to neuropsychology. But the core is neurophysiotherapy, not to be confused, of course, with physiotherapy itself. There is a saying in the United Kingdom: give a man a fish, he will eat for a day. Teach a man to fish, and he'll eat for many months. We don't just do therapy, we believe it's very important to give the ability to the person to know how to maintain a good quality of life. And it's the objective of any care in the community centre to be there to support the family and the individual. The combination of early intervention is currently under research being carried out by Oxford Brookes University, European Parkinson's Therapy Centre itself, and with the support of the European Parkinson's Disease Association. Indeed, the initial results and results of the ParkNet project itself shows that better care does not mean higher costs. Indeed, cost savings can be estimated around 20%, whilst improving people's quality of life and quality of care. Why do some countries still place so much emphasis on hospital care, when all the evidence suggests that early intervention, education and support are in the community are what people with Parkinson's really want? Answer is that the legacy of hospital care and focus on neurologists in hospitals has created an if not done here philosophy. The training of neurophysiotherapists in the community, speech therapists and other disciplines means it will not be done in a central location, and neurologists will no longer be the gods they were, to use the words of Beth Bloom. The truth is, they will become an essential part of a network to give support to people with Parkinson's and their families. Indeed, Roy Dorsey, who has a lecture during this Insight conference, has been pioneering video conferencing in treating people with Parkinson's. There's been little research into early intervention itself and the effect it has on cost. Speaking with the Fox Foundation, EPDA, Davis Finney Foundation, and others, our surprise is that they too had little information. Hopefully our new research, which includes a questionnaire, which we made available through national associations across Europe, through social media and promoted on radio, blogs and magazines, it should reach over 1 million people with Parkinson's in 10 different languages. There's more research backing the need for care in the community, as the ParkNet project has shown. This other element of care in the community, understanding that Parkinson's is a complex condition and requires 4 pillars of therapy, not just the pills, and especially access to neurophysiotherapists who know how to apply movement to slow progression and to limit symptoms, is essential. All of this must be underpinned by partnership, dignity and empathy. And as one chief executive officer of a pharmaceutical company used the word humanity. Education is so important. This short video clip says something very profound about education.
When we change the way we look at things, the things we look at change. And we need to change the way we look at things. When we change the way we look at things, the things we look at change. And we need to change the way we look at things.
The way we see our Parkinson's directly affects the way we live with our Parkinson's. And we must change the way we see our Parkinson's. I think it's time to get changed again and go back to the lake. I know the perfect ice cream shop. Come on, let's go. Yogurt flavoured ice cream. Absolutely my favourite. We are, of course, back at the lake in a change of clothes. But returning to the subject, the opportunities, costs and realities of future care of people with Parkinson's. Let's summarise these points one by one. The opportunities are for changing the way Parkinson's is treated with early intervention programs combined with care in the community, education, understanding and reassurance. All aspects that are fundamental to every person diagnosed with Parkinson's. As for costs, hospitals are for sick people or people with Parkinson's who have serious difficulty. Government should stop funding rehabilitation programs in hospitals and start focusing on supporting people where they are living, and understanding that people with Parkinson's want to have dignity, information, control, and in so doing they will reduce their costs. It's a win-win situation, ironic but true. The reality is that it will take time. Changes in attitudes, determination, visionary leaders, and a more free exchange of good practices and a lowering of egos to accept that there are alternatives that already exist, but most of all, it will need to be based on a mutual partnership between people with Parkinson's and those involved in their care. On the whole, I am optimistic, both for new drugs that will actually affect Parkinson's, the so-called disease-modifying drugs, and for common sense to play out as the costs soar and the truth becomes more and more obvious. After all, we are all in this together. Thank you.